I'm going to present some of our work on surgical planning in real scenarios. As I said before, we are inside the hospital, a university group also inside the hospital, and we have several clinical users with specific needs. And we're going to present some of the solutions that we are developing for their needs. They are users of intraoperative radiotherapy and also liver surgery, and they need some they have some demands on intraoperative imaging, surgical navigation, and image registration. Regarding intraoperative imaging, for instance, for intraoperative radiotherapy, what they would like to have is some kind of imaging, 3D imaging with attenuation information inside the operating room. So one solution is to use C-arms with 3D reconstruction. The one we have been testing one from a German company, but they have some limitations, and we are also working on using our acquisition, calibration, and reconstruction knowledge from small animal in order to reconstruct C-arm images with conventional C-arms. Here you can see a projection and the same projection from the CT image in order to compare. The other area that we are working at is surgical navigation. Since the scenarios are complex and there are several users there with occlusions and so on, we are using a multi-camera system with 8 cameras. This is an experiment we performed this summer, in which from the CT we have a phantom and the applicator from IOERT. We obtain the position of the applicator with the tracking system, and then we image the phantom and the applicator, and we measure the difference, the accuracy in our location of the virtual applicator related to the real one, with accuracy in the order of 2.6 millimeter. And this kind of system could be used in a real scenario easier than the commercial ones like Polaris or similar ones. Then another possibility is, instead of using acquisition modality inside the operating room, we can transport the patient. This is a specific coach we have designed. With this structure, you can attach it to a CT-compatible bed, and then you can image the patient when the patient is being transported to the linear accelerator. These are one of the first 2 images we have obtained. And with this image, you can do real dosimetry with real intraoperative imaging. When you have these images, another area we are working at is, okay, is it possible to register the intraoperative image and the preoperative one if we do resection, virtual resection, and with the formal registration of this image, and then we can compare and see if the pre-planning and the intra-planning match or they didn't match, and other applications for image registration with Polytechnic University. So what's our wish list in this surgical navigation area? We would like to exchange knowledge. We know that there are several groups that are experts in surgical planning and image-guided surgery, and we have new directions that we would like to explore, like, for instance, other image modality for intraoperative imaging, like ultrasound or other possibilities. Thank you.